Earlier in the week, we told you about a virus on the prowl in India, the Nipah virus. Another Indian has fallen prey, unfortunately. A 39-year-old man in Kerala has tested positive for the Nipah infection, and the number of cases now has gone up to 6. 2 have already died. 4 cases are active. Meanwhile, a 60-year-old woman is also suspected to be infected. What do we know so far? The man who is now confirmed positive was under observation at a hospital in Kozhikode. He had earlier been admitted at the same private hospital where other patients who tested positive were treated. One patient died on the 30th of August, another on the 11th of September. The second deceased had come in contact with the first one briefly, and the relatives of both were also hospitalized. They also showed Nipah-like symptoms. And here's what else we know so far. Health workers have tracked down contacts of the confirmed cases. 950 more people are now under observation. Out of these, 231 have been classified in the high-risk category. 21 have been hospitalized. How is Kerala dealing with the outbreak? The government has issued a travel advisory. Masks are officially back and mandatory. Tourists have been advised to wear masks at all public places. States bordering Kerala have put up stringent checks for those with possible symptoms. A number of important cultural celebrations and programs have also been rescheduled. Apparently, this is the peak tourist season for Kerala, but the virus spread and has created panic. And why not? This virus is also causing a lot of concern. Vigil is especially high in the Kozhikode district where the infection has spread. The state government declared 9 village councils as containment zones, and in these areas, only shops selling essential goods will be allowed to function from 7 a.m. to 5 p.m. However, no curfew timing has been announced for pharmacies and health centers. Hundreds of accredited social health activists visit the homes of residents every day. They conduct medical checkups, they monitor the people, they collect data. Needless to say, these containment zones are out of bounds for travelers. Educational institutions throughout the district will stay closed till Saturday, while all gatherings and functions have been prohibited till the 24th of September. 75 isolation rooms, 6 intensive care units and 4 ventilators have been kept ready at Kozhikode's Medical College Hospital in case things go south. The Indian Council of Medical Research has delivered antiviral to combat Nipah virus outbreak to Kerala, and so far it is the only option available to treat Nipah virus infection. Its efficacy has not been clinically proven yet. A mobile laboratory has also been sent to test the sample. India will also procure 20 more doses of monoclonal antibody from Australia. Whether or not you live in Kerala, should you be scared? We have already seen what a virus can do. We just dealt with the COVID-19 pandemic. Nipah is like the coronavirus in more ways than one. In fact, Nipah is a zoonotic virus. It jumps from animals to human beings. It is also highly infectious and can be transmitted from one human being to another. Nipah is considered to have originated from bats, fruit bats to be specific. Nipah can also infect other animals. This includes dogs, cats, horses, pigs, sheep. Like COVID-19, Nipah symptoms can start showing as early as 4 days of infection. And what happens once the virus has entered your body? Usually it begins with a fever, a headache may follow, and then cough and sore throat. Like COVID-19, Nipah also can result in breathing difficulties, and this can last up to a couple of weeks. And then the virus aims for the brain. The patient develops encephalitis, as in a major swelling in the brain, and with that comes drowsiness, disorientation, mental confusion, and here on things progress fast. A patient usually lands in coma within a day or 2, and in extreme cases, dies. Should you be scared? The longer answer is, Nipah has a mortality rate between 40% and 70%. This is according to the World Health Organization. Since the year 2001, there have been a total of 6 Nipah outbreaks in India, including this one. 3 of them have been in Kerala alone. The last one was during the COVID-19 pandemic, in fact. And in the last 2 decades, Nipah virus has claimed some 70 lives. Can we really afford another pandemic? WION now available in your country. Download the app now. Get all the updates on the move.